Hi, it's Dr. Van Dyke. Now we're going to talk about PCOS. This is the handout that we've authored for our patient education library about PCOS, or polycystic ovarian syndrome. What is PCOS? PCOS is thought to be the cause of up to 90% of ovulation disorders. It is characterized by evidence of excess male hormones, or androgens, and examples of this would be increased facial, chest, back hair, or acne. It may be characterized by irregular menstrual cycles, and in an ideal world, polycystic ovaries can be seen on ultrasound. Usually patients have other metabolic syndromes as well. They may have obesity, high blood pressure, pre-diabetes, and some other things. PCOS is a complex and sometimes confusing picture, and because of this, it is a diagnosis of exclusion because other hormones can mimic the PCOS picture. How do we diagnose PCOS? We have to exclude other causes: gynecologic disorders like fibroids, thyroid disorders like an overactive thyroid, pituitary disorders like little tumors that make other hormones, and a certain type of adrenal disorder that a patient may be born with. After excluding other causes, we consider 3 criteria, and if the patient has 2 of them, we can call the diagnosis for PCOS. And these criteria are physical or lab evidence of excess male hormones or androgens, physical or lab evidence of ovulation dysfunction, and polycystic ovaries on ultrasound. Now that third one is very tough to get. I, in fact, have never seen an image of polycystic ovaries that was not in a medical school textbook. It's harder to diagnose PCOS in adolescence because sometimes irregular cycles and cystic ovaries are just part of normal development. So a patient has PCOS. Now what? The diabetes medication metformin used to be prescribed just for PCOS. You didn't have to have diabetes. But recently this has fallen out of favor. It will be used, however, if that patient does meet diabetes or pre-diabetes criteria. Oral contraceptive pills are currently the first-line treatment for PCOS. If additional control of masculine hair growth is needed, spironolactone is the drug of choice. Fertility and PCOS. Getting pregnant can be more difficult because of the irregularity of the cycles, and determining for sure if each cycle actually has a successful ovulation. It is fundamental to control and optimize all metabolic syndromes prior to conception: the BMI, blood sugar, blood pressure, etc. So lifestyle is the cornerstone. If a couple has difficulty conceiving, there are a number of medications that can be used to assist in reproduction. Either endocrine or OB/GYN professionals can facilitate this. And if these methods fail, a reproductive endocrinologist can assist with in vitro fertilization, or IVF. If you need more resources, the Mayo Clinic at mayoclinic.org has a section about PCOS, as well as the American College of Obstetricians and Gynecologists at acog.org.